Well, get this, a new op-ed in the Washington Post taking issue with the setting of the president's joint speech to Congress last night, arguing that it was a missed opportunity to reduce vaccine hesitancy, saying in part, quote, "A very damaging narrative is taking hold. If the vaccines are so effective, then why are so many precautions for the fully vaccinated? What's the point of getting inoculated if not much changes?" Surprisingly, I think a lot of people would agree. President Biden delivered his speech to a very limited audience last night as congressional officials ramped up security due to the pandemic. Only 200 people were invited to attend instead of the usual 1,600. Joining us now to discuss, Dr. Evan Levine, cardiologist and assistant clinical professor of medicine at Montefiore Medical Center in New York. He's also the author of this book on your screen. It's What Your Doctor Can't or Won't Tell You. Doctor, thank you so much for coming on today. Normally, we don't ask our medical experts to react to media reports necessarily. We always just want to get your medical take. But the Washington Post raised an interesting point, and I think a lot of people tuning in last night might have questions as well, based on the optics of what they saw. Again, two fully vaccinated people, Speaker Pelosi, Kamala Harris, who were wearing masks. Your thoughts on the message that decision sent?
I thought it sent a very poor message. So we already have people refusing the vaccine. The number of vaccines are down now from the past couple of weeks. I think about 17%. If I may quote John Maxwell, a leader is one who knows the way, goes the way, and shows the way. Come on, man, show the way. You're in an auditorium. What should have occurred is something similar to this. For those who are comfortable and who have been vaccinated, please take off your masks. We need to convince people to accept the vaccine. We can't wear masks for the next 50 years. The only way out is the vaccine. And we have lots of people who are reluctant to take the vaccine. And when we see people distancing themselves, both who were vaccinated, wearing masks, what message does that send? These are leaders. Show the way. Yeah. Take the mask off because you're vaccinated.
Yeah, you know what? That is the medical opinion I had been waiting to hear. But you know what? The CDC had come out with their guidelines, and if we could pull up the graphic for it, it takes a look at what you can and can't do even if you are fully vaccinated. If you are fully vaccinated, again, this is their outdoor guidelines. So you can go outside and you can gather. The only time you need a mask if you're vaccinated outdoors is when you're in a crowded outdoor event like a live performance, parade, and sports event. However, it doesn't clarify what crowded means, so I do have a few questions about that. But take a look at what's indoor, right? You look on the right side of your screen, this vaccinated individual is still wearing a mask for all of these listed events. That's going to get your hair cut, going to a museum, going to public transportation, a small gathering of fully vaccinated and unvaccinated people from multiple households, going to an indoor movie theater, full capacity worship service, singing in an indoor chorus, you still got to wear the mask, eating in an indoor restaurant or bar. Again, you'd have to remove the mask to eat your food, but hold on to the mask because you need to keep wearing it. And also those high intensity exercise classes, still wearing masks. As you say, is this guidance encouraging?
Well, this is a special circumstance. Let's not forget the CDC says that because we don't know who is and who is not vaccinated in those circumstances, your barbershop, the theater. But in this auditorium, we know who's vaccinated, okay? So in that circumstance, what a message to send. Hey, we're all vaccinated, and because we know we're vaccinated and the vaccine is so good, we could take the mask off. Let's not compare the CDC suggestions for the big unknown versus something in a small auditorium, a special circumstance where these people hopefully are all vaccinated and could safely take their mask off. That's the message they should have sent. That's what leadership's supposed to do, lead by example.
Yeah, but we could talk specifically about those Americans who are still deciding whether or not they should receive the vaccine. Now, they're not likely going to be in a chamber of fully vaccinated congressmen and women. So when they're looking about whether or not they would see some benefits of, receiving the vaccine, of course, they could protect themselves from developing a serious case of COVID-19. Set that aside for a moment. Again, you're looking to get back those freedoms. Could the CDC come out with a different guideline saying perhaps maybe after a certain time we can all remove the masks? A lot of people are ready to do that. They're just not seeing the incentive.
Well, I think the CDC is being very cautious and they're taking baby steps. So this week, they finally said it's okay if you're vaccinated, you can go outside. Well, maybe in a few more weeks, especially if more people are vaccinated, they'll have another statement. But this was the opportunity to show people that we feel that we're leaders, we're vaccinated, and we can sit in an auditorium without masks. That was the time to show that example. So maybe in 2-3 weeks or a month, the CDC can then further their statements and say, hey, it's now safe for people to be in an auditorium or certain rooms or whatever and not wear a mask. This was the opportunity in that specific environment for our leadership to say, we feel safe and we could take the masks off.
Yeah. Okay. Dr. EvanLevine, we appreciate you joining us here on the program.
Thank you.
Thanks so much.
Said so eloquently, I think, what a lot of us thought watching this whole thing. Got Newsmax News Minute time. Rachel Roller joining us live in the studio. Rachel.
Yeah, that's something we talked about a bunch this morning on Wake Up America as well, Sean. But let's take a look at some of